Heart sounds now also, which are Gallop sounds, are of two types, S3 and S4. In S3, which is a ventricular sound by nature, so it occurs after S2. Okay, heard due to rapid filling of ventricles during diastole. It will be a turbulent flow to ventricles. Okay, this may be normal if seen in children, young adults, and pregnants. Abnormal when it is heard in age more than 40 years with heart failure, restricted cardiomyopathy patients, and patient with high output. Second Gallop rhythm we can hear is S4, which is a atrial gallop or sound. So it is heard after S1. It is due to blood being forced into the stiff ventricles. Normal when seen in elderly, but abnormal when seen in children, young adults, patients with ventricular hypertrophy, patients with acute MI.